Welcome to The Explainer. Look, today we're tackling something that affects so many of us, yet it is so often deeply, deeply misunderstood. We're going to dive straight into the physical and emotional realities of agoraphobia. But more importantly, we're going to use this time together to chart a safe, totally manageable path for you to reclaim your independence. So, are you afraid of losing control? I want to speak directly to you for a second here. If you've been dealing with this, I want to completely validate what you are going through. See, the core fear usually isn't even about the specific public place itself, right? It's not really about the grocery store or the subway or a crowded room. It's actually about that terrifying internal sensation of losing control while you're in those places. It's a heavy burden to carry, but honestly, you are absolutely not alone in feeling it. Here's a quick look at our agenda. We'll be covering how to recognize the symptoms, the actual medical definition, what causes it to start, a step-by-step recovery process, how we ensure treatment is clinically safe, and finally, how you can take that crucial first step. Okay, section 1. Let's start by recognizing agoraphobia symptoms. The clinical definition of agoraphobia is basically an intense fear of being in situations where escaping might be difficult or where help just wouldn't be available if you were to have a panic attack. So on a human level, this totally makes sense why it leads to avoiding public spaces, dodging crowds, or, refusing to travel alone. It's essentially your body's autonomic self-protection mechanism kicking into overdrive. When professionals look at this condition, they're really looking at two sides of the same coin, the physical reaction and the avoidant behavior. On the physical side, when you feel trapped, your nervous system essentially sounds a massive alarm. We're talking rapid heartbeat, sweating, chest pain. It literally feels identical to a full-blown panic attack. And then comes the avoidant behavior. To stop those awful feelings from happening again, you start changing your life. You stop taking the bus, or you avoid long lines. And over time, your safe zone literally shrinks. For some, it shrinks so much they can become entirely housebound. There's this really important quote taught to mental health professionals. It says, "The fear is not necessarily of the place itself, but of the internal sensation of losing control." I really want you to absorb that. Your body is just reacting to an internal alarm system. Knowing this completely normalizes your experience. So please let go of any self-blame for those intense physical reactions you've been fighting. It's biology. Moving on to section 2, the medical clinical definition. Clinicians actually have a very specific roadmap they use to understand your symptoms. They look for certain features to confirm a diagnosis, basically checking to see if the anxiety your body is producing is out of proportion to the actual danger. They look at physical responses, like that rapid heart rate or GI distress we talked about. They look at avoidance behaviors, like maybe you absolutely need a companion just to leave the house. And they look at cognitive bias, which is that intense, overwhelming fear of a catastrophic outcome. And a key piece here is time. For a clinical diagnosis, these symptoms usually need to be persistent for 6 months or longer, and they have to be causing real distress in your daily life. This timeline is so important. If you've been watching your world shrink for half a year or more, that's a huge sign that these are persistent symptoms requiring actual professional support. You can't just tough it out. And honestly, you shouldn't have to. All right, section 3. Let's look at causes and onset factors. So, what actually kicks this whole thing off? Well, there are usually 3 main culprits. First, it often starts after a spontaneous panic attack. Your brain literally wires itself to create a learned association between, say, the grocery store and the trauma of that attack. Boom, a trigger is born. Second is genetics. If your family has a history of anxiety, you're just at a higher risk. Biology matters here. And third, environmental stressors, things like losing a loved one or a massive life change. I want you to hear this loud and clear. Biology, genetics, and life trauma are the main drivers here. It is absolutely not a character flaw. That brings us to section 4, which is the best part, the step-by-step recovery process. This is the clinical checklist we use for recovery, and it's super structured. It starts with education, basically learning exactly how your fight or flight response works so those physical feelings aren't so mysterious and scary anymore. Then symptom monitoring, like keeping a daily journal. Step 3 is cognitive restructuring, where we start to challenge those anxious thoughts. Step 4 is absolutely crucial, gradual exposure. Notice I said gradual. We're talking about slowly re-entering environments in a highly controlled, safe way. We pair that with relaxation techniques like deep breathing and, of course, ongoing professional consultation. It's highly systematic. We take it one step at a time so you are never, ever overwhelmed. Section 5. Ensuring safe clinical treatment. Listen, a real professional clinic is never going to push you past your absolute limits. Safety is everything here. Before starting any kind of exposure program, strict prerequisites have to be met. We do a full medical evaluation to rule out things like thyroid or heart issues that can mimic anxiety. We make sure you have a stable support system in place. And importantly, our practitioners are specifically trained to recognize your personal tolerance limits. They are regularly recertified in rescue protocols for severe panic. A responsible provider's entire job is keeping you physically and emotionally safe, making sure you don't experience further trauma while you're trying to heal. Finally, Section 6, taking the first step. Simply understanding these symptoms, that is literally the first step toward taking your life back. By just being here and engaging with this explainer, you're already doing the work. All the public health data shows that early intervention is the absolute best predictor of a great outcome. Spotting the signs now means you can get the right level of care before your world gets any smaller. And hey, that is exactly where Community Minds comes in. If you're looking for an authoritative but incredibly compassionate guide, they are ready for you. Whether you want to come in person to the Westbury, New York clinic, or if you'd prefer to start with teletherapy from the absolute safety of your own home, they offer amazing, localized paths to evidence-based care. Managing this and getting your independence back is completely possible with their dedicated team. Now, your immediate well-being is always the most important thing. If you are in real emotional distress right now, please use these resources. They provide free and totally confidential support 24 hours a day, 7 days a week. You can call or text 988 for the Suicide Prevention Lifeline. You can text HOME to 741-741 for the crisis text line, or just dial 911 in an emergency. Please remember, this safety net is always there for you. So, I want to leave you with this final thought. Are you ready to take that step today toward a more mobile, confident future? Think about it. You've got the knowledge now. You understand the clinical science, and most importantly, you know there is a safe, completely structured path forward. You really don't have to navigate this in the dark anymore. Reach out to Community Minds and take that incredible first step toward reclaiming your world.